Well, a newly discovered coronavirus variant is spreading across parts of the UK. Thousands of cases have now been detected beyond London and other areas that were under lockdowns. The variant is believed to be up to 70% more transmissible, although it's apparently not deadlier than the most common form of the coronavirus. More than 40 countries have now closed their borders, however, to travelers from the UK. The United States has not taken that step. So we want to talk more about this and all the latest news when it comes to the coronavirus. We want to bring in Dr. Amesh Adalja. He is an infectious disease expert and a senior scholar at Johns Hopkins Center for Health Security. It's really a pleasure to have you back, Doctor. So let us talk about the ongoing debate about banning flights from the UK with this new variant. Dr. Anthony Fauci has said that he doesn't really see the need for that action currently. You yourself have been sort of critical of travel bans before, but it seems like a lot of other countries think it's a good thing to do. What's your take on this?
I agree with Dr. Fauci that travel bans are never the answer when it comes to an infectious disease emergency. They tend to backfire. They tend to have a lot of other negative consequences. And we know that many countries are not even sequencing their coronavirus isolates. So this variant likely is already in many countries already. And what we saw is a crisis at the border between England and France, where there was an issue with whether or not people are going to get food. So travel bans aren't the issue. I think that testing people before they come to the United States on a UK origin flight, that makes sense. But I would not advocate for a full travel ban. And I do think we probably do have isolates of this virus already circulating in the United States. It's just that we don't sequence the way the United Kingdom does.
So you just brought up something, you used a medical term that people might not understand, but it was something that was brought up in a recent New York Times editorial. In that editorial, they discussed the new variant, criticized the U.S. government for not genetically sequencing enough, versions of this virus. Just explain to us what that is, what you were suggesting that we kind of missed the boat on, and could it make the difference when we look towards the future and look towards the evolution of this virus?
Sure. So what sequencing refers to is it's not just testing people. It's actually taking the specimens and trying to go through exactly which strain, which variant is causing the infections. And we do that for a handful of cases, not that many. If we've got 17 million cases, they're sequencing a very small proportion of them. So we know that people have coronavirus, but we're not looking to look at the different mutations and the different strains that are evolving. And you have to remember, all viruses mutate, all viruses kind of diverge a little bit from each other. And if you do that a lot and you have full capture, meaning you've got a good sample of them, you understand what's going on in your given country or your state or wherever it might be in terms of the evolution of the virus, so that if there is a worrisome variant, one that might be more transmissible, one that we worry about in terms of can it escape certain treatments, all of that you would know ahead of time. So I do think that this is something we need to be doing more of. We need to be having real situational awareness of how the virus is evolving in the United States.
So the CEO of BioNTech said that he's confident that the vaccine that BioNTech developed with Pfizer, that's the one that we often call the Pfizer vaccine, that it will be effective against this new variant. A lot of experts have been projecting calm around this, but I think that people wonder why. If it's kind of like a new version or a mildly different version of the COVID-19 virus that we're used to, how can you be so confident that the vaccine will work?
We can be confident because we know how vaccines are developed, and we know that when a person gets vaccinated, and I just received the Pfizer vaccine last week, that your body makes a whole host of antibodies, not just one specific antibody. And it also induces what's called T cells. Those are a different arm of the immune system that can also attack the virus. So all of that really gives you a robust armamentarium, a robust set of tools that your immune system uses against the virus. So it's not usually that a virus automatically or easily becomes what we call a vaccine escape mutant, or something that can evade the vaccine. They are doing tests, both Pfizer and Moderna, and I think we'll get some more information, but the early data looks like that the antibodies that are induced by the vaccine are effective against this new variant, so it's not anything to worry about. And the other thing is, even if it weren't, the technology used to make these vaccines, mRNA vaccines in the Pfizer and the Moderna versions, those can be easily adapted if there needs to be any kind of updating. But I don't think we're there yet, and I think we are going to have the vaccine program be effective at halting this pandemic, including the new strain.
Yeah. A doctor friend of mine who tried to sort of dumb it down for me compared it to reading a sentence where there are a couple of letters that are off in a word. Even if the letters are off, you can pretty much understand the gist of the sentence and read it. Same thing for the virus. Even if there's a little bit of a change, or a vaccine, even if there's a little bit of a change in the virus, the vaccine can still sort of recognize it, and the immune response will still work the way it had always intended to work. That being said, what was, I think, in early reporting sort of described a variant of COVID-19 in South Africa as the same one in the UK. Now it seems like it might be something different. Can we learn anything from how the virus is changing with this new information?
We can learn a lot by how the virus changes because we can understand what types of evolutionary pressures are on the virus. You know, the virus, from its standpoint, if you want to kind of anthropomorphize it, all it wants to do is infect more people and make more copies of itself. So it's going to evolve in a way that allows it to do that. So when we see where mutations are cropping up, we understand more about each of the proteins that the virus has and what role they play in infectiousness to other people and how easily it binds to the receptors in our body. So we can learn a lot about that. We can also learn about what to expect and what to look for. We can study the virus in detail to understand which mutations are really, really important, because there's lots of mutations that are occurring. Most of them don't do anything, but we can understand which ones are really important by studying those mutations. And then we can also think about what mutations are the ones that are going to derail the vaccine, derail a drug like remdesivir. All of that's important, and it's really something that a lot of people think of mutations as something from Hollywood movies, but most mutations don't do that, and I think that's the important point, is that all viruses evolve, all viruses mutate. This isn't something that's surprising. We all expected this, so there's nothing to panic about, and the scientists are studying what happens in a lab if it actually influences how this virus transmits in the wild.
Great information. I bet you put a lot of people's mind at ease. Dr. Amesh Adalja, thank you so much.
Thank you.